Japanese patient.
An informational video on the do's and don'ts of Japanese culture.
Hi, Miss Yoshimi. How are you doing today?
I'm okay. I've been waiting here a while.
I know, I'm very sorry to keep you waiting. The test results just came back, and I'm sorry to tell you, but you have diabetes. It seems that it came from your poor diet.
I do not have a poor diet.
Well, judging from what I saw on your list of your history, yes, you do. Well, it's nothing that insulin therapy and, you know, a good diet and better exercise can't, you know, cure. So we'll get you going with that, and then you'll be on your way home in no time. I'm sorry.
Okay.
Japanese people have a very strict view of time, and when kept waiting, they become offended. When the nurse said she would visit the patient at a specific time and was late, the patient became extremely unhappy. The nurse then continues to speak to the patient in a loud, accusatory manner about her diet and condition. This is also offensive. When diagnosed with a disease, it is often customary to allow enough time in hospital to recover. Suggesting that her rehabilitation be speedy is not customary.
Oh, that
Hi,
was
Miss
very
Yoshimi.
quick.
How are you doing today?
I'm doing very well.
I'm sorry to tell you I got your test results back, and it looks like you have diabetes. I'm very
no.
sorry. Perhaps,
Serious?
well, with a little insulin therapy and, you know, some tweaking of your diet, we can get this worked out. It should be no problem.
Oh, thank you.
We'll have a dietary consult for you, and they can tell you what, you know, what are good for you and things you should avoid, and we should get it all worked out. It should be no problem at all.
Okay, thank you so
Okay?
much.
I'll have that scheduled for you, and we'll get them here as soon as possible, okay?
I appreciate it.
All right. If you need anything, you let me know, okay?
I will.
All right. Thank you.
In this situation, the nurse was on time, spoke indirectly on the cause of the patient's disease, and suggested a problem-solving approach by involving dietary. The nurse also spoke in a soft, empathetic voice. Sick time in the Japanese community is often granted for as long as it takes a person to become well and fully rehabilitated. Healthcare workers should remember that the degree to which the Japanese culture is strictly followed is determined by the amount of generations removed from the actual immigrant to the United States.
Hi.
Hi, Mrs. Yoshimi.
Hi.
You seem a little upset today. You know, whenever I get upset, it always helps me to talk to my priest. I'll send up the hospital clergy for you, okay?
In the Japanese culture, they keep most matters within the family, especially illness. They are very private and look at the father as the head of the household. Medical decisions are made as a family, and the needs of the family come before any one family member. When a family member is given a terminal diagnosis, the family accepts the responsibility to emotionally support and comfort the patient. The nurse in this situation overstepped her boundaries by sending the clergy to the room without asking. This is how the situation should have gone.
Hi, Mrs. Yoshimi. You seem a little upset today. Is there something you'd like to talk about? You know, we have a lot of services here at the hospital that could be available to you.
Oh, no, thank you. I'd like to talk to my family.
Would you like me to contact them for you?
Oh, that'd be lovely. In my culture, we don't talk about medical issues outside of the family.
Oh, okay. Well, thanks so much. Maybe later on I can come and talk to you about your culture some more.
Yes.
Hi, Mrs. Namasaki. How are you doing today?
Good.
That's good. Is there anything I could do for you culturally to fulfill your needs during your pregnancy?
Yes, there's a few things that I have. Okay, most importantly, an important thing is that we, as pregnant women in the early stages, should consume hot foods to keep yourself in healthy balance.
Okay.
And we gotta avoid hot foods during the last trimester. So breastfeeding is we take very seriously, so I will be breastfeeding as well. During the 5th month of pregnancy, you know, we as Japanese pray a lot for safe birth to our Buddhism. And another thing is I have severe depression, so you know, I don't want my family to know, because any mental illness or depression is considered shameful in the family, so I wouldn't want, you know, anybody knowing that or anything like that.
Okay.
Also pain, you know, especially during childbirth, is you're supposed to compose yourself, and it's considered shameful to show pain, so you have to keep yourself composed. And also I use acupuncture. I'm a spiritual healer, so I don't use any medicine, so I'll be using acupuncture and you know, a lot of meditation during the birthing process.
Okay.
And I think that's about it. Also, if we do get medications, we like it to be low dose. We don't like high doses of medicine. We like it to be, if it has to be at all, it's the minimum as possible. And I think that's it.
Okay, well I recorded everything for you, so you shouldn't worry about anything and you'll have a comfortable pregnancy.
Okay, thank you. Hi, this is Noshimi. I bought you some nice
Oh, hi.
cakes for you.
Oh,
I knew you were
that's-
hungry.
That's so sweet of you, but I can't eat this. I have diabetes, and that's one of the major ailments with Japanese people nowadays.
Oh, okay. Well, that's good to know. I'll note that down on your chart.
Thank you.
Is there anything I can do for you while you're here culturally for your health?
There's not too much regarding my health that I need culturally, but I am at risk for hypertension because of I eat a lot of sodium. My doctor says that I eat too much soy sauce.
So you have a high sodium diet?
Yeah, I need to maybe fix that a little bit. But other than that, I practice Kampo, which is herbal medicine. So my family brought in some tea for me, if you wouldn't mind being able to fix that for me when I would like that.
Oh, okay.
Thank you.
Any specific tea? Green tea? Green tea probably, yeah?
Green tea, please.
Yeah.
My cousins, I've noticed, I just came here from Japan and I've noticed my cousins eating a lot of red meat, and I'm not used to that. I'm used to more of the fresh seafood and vegetables and rice. So it's taking a little bit getting used to their diet here is a little bit different. I've also noticed that the obesity rate in America is a lot greater than in Japan. I've never seen more obese people than in America. So if you could just help me with those
Keeping your diet so you don't...
Yes, that would help me a lot.
We could do that. We can set up a diet plan for you that would help with your sodium intake and, you know, with the obese issue if you're afraid of that.
Okay, thank you.
You're welcome.
Okay, excuse me, Mrs. Yoshimi, is there anything that we haven't looked at or that you need culturally?
I practice Kampo, which restores energy flow by using measured herbs. I already am sick, as you could see, and I would like to prevent any more ailments from happening, so if you could help me with that, I have herbs that maybe you could help measure for me.
Okay. Also, besides herbs, Japanese culture drinks green tea. It is known for having multiple health benefits. It is full of antioxidants, fights viruses, slows aging, lowers high blood pressure, and fights cancer, as well as lowers cholesterol. It stimulates calorie burning process and has a relaxing quality and reduces anxiety and stress. Japanese culture mostly consists of a bowl of rice and miso soup, even for breakfast. Fish and meat. Meat is traditionally only eaten, red meat, 2 or 3 times a month, except such dishes as sukiyaki, which are considered rare. Dairy, however, is also avoided. Little cream, butter, and cheeses are consumed, which puts nursing and pregnant women at risk, which means they must be put on a calcium supplement to ensure they have enough calcium. Sugar is also regarded as foreign. Many Japanese do not eat or is very little. Asian cultures and diet is closely related to religious practices. I'll just start that one over. In many Asian cultures, diet is closely related to religious practices and tradition. It is extremely healthful diet. Illnesses that are in Western cultures, heart disease, cancer, and obesity, rarely are seen in Asian cultures. Rather, they are healthier and live longer. Asian diets are influenced by culture, religion, and agriculture. Low in fat, high in fiber, and full of fruits and vegetables. Many believe it is a secret to long and healthy life.